I think being a physician is one of the greatest things you can do. I have a son who is a second-year medical student at the Vanderbilt University School of Medicine, and when he told me he thought about going to medical school, I thought it was the greatest thing in the world. Right? I encouraged him to do it. He could do whatever he wanted to, but would I ever discourage him from being a physician? No, I never would, because all these other things notwithstanding, everything we hear about, from the time you walk into the examining room to talk to a patient to the time you leave, that is a opportunity to be valued and cherished, right? Because the relationship you develop with a patient is very powerful, is very meaningful, and the people who should be physicians should recognize the power of that relationship.
It sounds rather dramatic, but you hold their life in your hands, and all of a sudden that hits you, and you realize that all that training, all that you were taught, this is what it's for this moment.
To be a good doctor, you have to care, because I think when you stop caring, then that's when you become a bad doctor.
There's a tendency for surgeons to be seen only as procedurists. Well, operate, take care of them, and then we're finished, right? Yeah, it's great to be able to operate and improve somebody's quality of life like we do, but it's the interactions that I think are important.
I think the most difficult thing when you start as a new doctor is understanding or realizing that you're not going to be able to help everybody. There are some patients that whatever you do, they're not going to improve. And as a junior, that's very difficult to get your head around.
I think that a lot of it is talent, but character is a very important thing. Let me tell you about professionalism in medicine. We can teach individuals. We have one of the largest residency programs in the country. 12 residency years, 62 orthopedic residents in a 5-year program. Almost without exception, we can train them to know what they need to know to be an orthopedic surgeon, learn how to operate on the important procedures in orthopedic surgeons. And we can even teach them a little bit how to interact with patients. However, you can't teach them to have the ethics, right, and the professionalism necessary to be a physician. They need to come to us with the ethics, that their parents have to do that. And we layer onto that the professionalism of being an orthopedic surgeon. If you can be as talented as anybody, but if you don't have the professionalism, the interactions with patients, the ability to understand what you're doing and how to care for patients, how to interact with patients, right? Then you've not fulfilled the responsibilities you have of being a physician.
It reminds you of why you're here and why you put all the work in and why you sacrifice so much to carry on being a doctor because of those moments.
When you're the person that makes that diagnosis and starts the treatment, when you've saved someone's life, it stays with you forever.
I really don't know why I wanted to be a doctor. I just know that I always wanted to be one, and I think it was because my mum was one and she was such an amazing role model. And I think I just saw the difference that she made. A couple of years ago, she went for a normal mammogram and she was diagnosed with breast cancer 3 days before my medical finals.
White cell count is up.
She did have to have a big operation. She did retire early from work. But it really made me realise that being a doctor, as much as it's about the medicine and the medical decisions, actually in situations like that, it's about the person as a whole, but also about their family as well.
My advice is that you should always recognize what it is that attracted you to being a physician and what I think should have attracted you to being a physician, surgeon or an internist or any other medical specialty. What should have attracted you is the ability to make patients better, to interact with patients and to take somebody who is ill and make them better, somebody that can't do what they need to do and help them do what they need to do. That's a very powerful thing. And the next generation of physicians should see the power in that and the attraction of it, because when all is said and done, that's a very satisfying part of being a physician. And with all the difficulties we have with the bureaucracy and managing practices and healthcare reform, that's a constant in this, the relationship you have with your patients. And I think that goes a long way to making for a very satisfied physician for many years.